for part 2, psychological antecedents and consequences of sport injury. In this section, we're going to talk about psychological factors that can come before an antecedent or after injury. And we won't just be talking about sport injury, we'll be talking about any kind of physical activity or other performance-related injury. And hopefully you'll recognize what we're trying to come across with, as we've talked about throughout the whole semester, is that reciprocal relationship between our psyches and performance, and then our performance and our subsequent psychological functioning. Things to keep in mind, the psychological aspects of sport injury, that athletes are no more or less likely to exhibit psychological pathology than the rest of us. They do get a lot of media attention when they do things like abuse a domestic partner or act out, but from a numbers standpoint, they are no more or less likely than you or I to show psychological pathology. One of the things we do see with our student athletes is this representation or lack of representation, that they are more than their sport, and a lot of reluctance to seek help. For example, our student athletes here on campus have asked in seeing the counseling center if they can come in the back entrance. Now, with all due respect to our student athletes, this is Western Illinois University, not a more high-profile Big Five major institution like, say, Alabama or Ohio State, but our student athletes here still feel that their visibility is of concern for them. And then the last one, certainly we can speak to this, the NCAA and the other major professional leagues, is that organizations are less receptive to providing psychological care and screening for those folks. So some things to think about: how might psychological factors predict injury, and how might they influence recovery? When is someone better, and when should someone return? And then ultimately, really, what is an injury? We'll talk about what is an injury in a moment. Let's start with a conversation about precursors, or things that happen before. The idea here is that stress-induced changes in our functioning lead to a stress response, and those stress-induced things can be modified through our coping resources or personality, or can be amplified by those too. And that stress response is composed of a physical as well as a psychological component. So our history of stressors can be our life stress, the daily hassles, previous injuries. We talked about our Holmes and Ray experience as well. Our coping resources, what kind of coping resources have we earned or have we been taught by our parents and through our educational system? And what we find is that athletes and people in general with fewer coping resources have greater predisposition to injury and greater rates of injury as a result. We also see greater rates of injury in those who, what we think of as thrill-seeking or risk-taking, so base jumpers and things like that. We also see in these personalities greater risk of mood disturbance and pessimism and those kinds of things. But what's not been researched, what's still unknown, is that role of hardiness and confidence and achievement motivation. So there's a lot we don't know. We do recognize that when you have that internal locus of control, and much like we talked about 2 units ago, you have decreased rate of injury, and those with high trait anxiety, like myself, have higher rates of injury. So we're cautious about those from a personality standpoint, but we don't necessarily have a great appreciation for what their role is in sport and physical activity injury. When we talk about our stress response, as I mentioned, we have the physical as well as the psychological, what we call a bidirectional stress response, that our cognitive appraisals, how we appraise. So I talked about the bridge, and I appraise that as a very stressful event. And what's my adequacy to go across there? What are the consequences? It's a 600-foot gorge, so can I hold on if the bridge breaks? Am I going to fall? How far am I going to fall? Those kinds of things. Examples we see in sport and physical activities. I see it a lot with our runners, cross-country runners, marathon runners, when they hit a hill. Some people in particular train for the hill, like the Boston Marathon. There's a huge hill, like the 20-mile mark. People purposely sprint up that hill to show their competition that they're in great shape. Others aren't prepared for that hill. They hit it, and it's like hitting a wall. And so, what's it mean to you? What's your perception of your performance when someone goes sprinting by you up a hill versus what's your perception of your performance when you suddenly have a hill that you didn't anticipate? Similar, it can happen if you're on an exercise machine at the gym and someone gets on and starts pounding away really hard and fast, and you're slogging through there. Maybe they're an elite athlete who just comes in for a little workout. You're there for your one workout every couple of days. So that's important to realize how we appraise things. And basketball is another good example. Whether you're playing pickup or competitive basketball, the idea that you have another shot. Take that shot, you run down the court, you come back and come back and come back and come back after misses and makes and those kinds of things. But if you appraise each shot as the ultimate shot, well then the game will end right there. But it never does it? So cognitive appraisals are an important part of our stress responses, as is our physiologic and attentional responses. So we do know that when we perceive stress, we have greater muscle tension or alterations in muscle tension patterns. We have higher blood pressure, higher heart rates, those kinds of things that can change our performance. We also know that our attentional changes, broad to narrow, internal, external, can change as well. So those are the two things that are two parts that weave together for our stressful response. And so as we enter into a stressful athletic situation, we can take some of the interventions from our last unit and modify our appraisals, modify our physiologic or attentional responses to help hopefully stave off or prevent sport injury. But injuries do happen. They are a part of sport. Injury can be a lot of different things to a lot of different people. For example, I wouldn't consider a blister on my finger as a faculty member to be an injury that changes how I can do my job. But if I'm a professional baseball pitcher or softball pitcher, a blister on my finger is cause for me to go on the disabled list until that blister's both resolved and I've gotten more callus on there and those kinds of things. Broken leg, I still got to come to work, but I'm going to be out, as it were, with sport. So one of the challenges we have with sport injury is, what is an injury? Is a blister an injury? Is an ankle sprain an injury? There's a lot of different definitions all over the place. When are you injured? One of the things we see is what's called an anterior cruciate ligament rupture, and there's some great evidence out there that, especially in women's high school soccer and college soccer, that an ACL injury in those athletes is considered a rite of passage. It is not a, oh, tragic accident. It's, oh, yeah, it's my ACL. Everybody gets one. Now's my time. And that's a very, very different perspective than what it used to be, that, oh, ACL, maybe career ending, Now it's another step in the process towards improvement. So it's really interesting about how we define sport injury. I'll give you a little case study here. We'll talk about this 2002 Olympic gold medalist freestyle aerialist who got hurt prior to or in October of 2004. She'd really never been hurt before outside some concussion. She had this aura of being injured, and she relied on and fell back on a number of others' perceptions of their advice for the injury. She had an ACL injury as well, and she returned to play at 44 weeks, which is a pretty reasonable return to full participation for an Olympic athlete. Not bad. What I'd like you to do is write down on the side sheet of paper what you think about that individual's performance and recovery thus far. Moving forward, so we have these cognitive appraisals coming about as a result of our sport injury, but we also have situational and personal factors, much like our freestyle aerialist does, and we need to think about those. So what's your history of stressors, your coping factors, your personality, those three marbles that kind of went into the antecedents to sport. And also personal factors such as demographics, who we are, what's our health status, those kinds of things. It's all different. And then our situational factors. What kind of environment are you in? Are you in a supportive environment? Are you in an environment much like our women's soccer we talked about, where they expect you to get hurt? Do you have access to rehab? Do you have access to good rehab who understands what kind of level athlete or physical activity person you are? How much of that sport ethic do you embody? So those are situational factors that get combined with our sport injury and that lead to another cognitive appraisal. And that appraisal influences recovery. So if you appraise yourself as being able to recover and having all your resources, you'll do better. If you appraise a self-perception of being unskilled and not sure about rehab, you'll have a less well recovery. If if you have a sense of relief or loss of being injured, that does happen, then you're going to respond and recover in a different way if you have those otherwise. So you can see now as we move forward, we've got our initial predisposition factors or antecedents leading to sport injury. We have cognitive appraisals as one of three pieces that influence our recovery outcomes: our emotional responses, our behavioral responses, and our cognitive appraisals. And so, what's a response to sport injury? It's that fear of unknown. Are we angry? Do we have it? Again, think back to the women's soccer example I gave you. It's just a rite of passage. It's just another big deal. Do we have a sense of grief or loss? My question for you is to think about, are emotional responses cognitive only or behavioral? I'm not going to answer that one. It's sort of a rhetorical question. What we do know is that when we have negative affect, we see less compliance and adherence to rehabilitation programs and less outcomes. And so my answer to that class question is that emotional response is both cognitive and behavioral. The cognitive piece being maybe my negative affect, and the behavioral being I have less compliance and adherence. If you don't see that, let me know. Hopefully that is visible to you. We also have behavioral responses alone that shape our recovery, whether it's how often and how well we work in our rehab, what other kinds of mental skills do we use, kind of coping and things. My next question for you is, do you think that these behaviors are controllable? Okay, I'll let you answer that. I'm not going to give you some input on that, but I am going to ask you another question in that, can we train our abilities to perceive, think about, understand, and manage emotions and behavioral responses? If emotional responses have both an emotional or cognitive and a behavioral component, can we perceive, think about, understand, and manage emotions? Therefore, can we also perceive, think about, understand, and manage our behavioral responses? Those are important pieces for you to be thinking about when you're working with your clients or working on your exercise program yourself. Things to think about: we have this psychosocial appraisal from our recovery outcomes. Do you see recovery as a threat, or do you see it as a challenge, an obstacle to be overcome, or an obstacle forcing you into retirement, or as a deterrent? Those are important perspectives. Is it a physical? Can you adapt practice and competition? Do you have a coach who's willing to adapt things? Do you have access to a pool to maybe do some aquatic rehab? How do you handle flare-ups? Do you perceive flare-ups as good, bad, or indifferent? And what do you do for them? Do you have a means of handling them? This next slide is actually number 25 of 34, and it's a really ugly one, and it's got this sort of drawn-out relationship, but I think I can explain it to you, and hopefully you'll understand. In the upper left corner, we have our antecedents. We have three factors that shape our stress response: stress history, coping, and personality. That leads to our stress response, which is bidirectional. It includes both cognitive appraisals as well as physiologic and attentional components. And that's a great time for us to intervene with some of the mental skills we talked about in the previous unit. And situational stressors cause that stress response. You'll notice that cognitive appraisals is there at the center of that slide on the left-hand side. These are antecedents to sport injury. Injury still happens. I'd love to say we could prevent sport injury, but yeah, that's not the case. But when and if injury does happen, we know that injury is modified or amplified by situational and personal factors. So now I'm at the center of the screen, and that these three factors lead to another cognitive appraisal. So we have this appraisal prior to injury, and we have appraisal post-injury. And that appraisal is an important part of our recovery outcomes that's paired with emotional and behavioral responses. So from a psychological perspective, we're looking at how we appraise our stressors and our coping resources, and how we appraise our physical and intentional changes as shaping or modifying our chances at sport injury. And we look at our perceptions of the injury as shaping our recovery. So we see perceptions before and after sport injury, and we know that those are places that we can intervene. So now's a good time to talk about a second athlete here who tore their ACL on October 2005 with a partial meniscus tear, which is a cartilage tear. A tear. Unfortunately, this is 11 weeks prior to the Winter Olympics in 2006. They had some previous experience with an ACL injury, and they returned to play at a reasonable amount of time. This athlete was very self-referenced versus other reference. They had no questions. They knew the injury and the rehab process inside and out, and they absolutely, completely overhauled their lifestyle. They really had essentially 48 hours to decide whether they're going to retire from professional sport or make a run at the Olympics. Because of the timing for surgery and those kinds of things with the Winter Olympics, they had to decide in a weekend, what do I do? Do I retire? Because I literally have to know by Monday, or am I going to have surgery? And so they had, very quick turnaround time for the decision. They didn't have a lot of time to mull it over. They chose perspective of having surgery. They said, you know what, I've got nothing to lose. The Olympics are coming up. I'm going to do my best to try and get ready for the Olympics, and I've been through this before, so I think I can do it. This athlete actually had a full return to play from this ACL injury, with actually a more severe injury than our previous athlete, in 11 weeks. They qualified for the Olympics at 14 weeks. They jumped in Olympic competition at 18 weeks. They had only been jumping on stow, so they were a freestyle aerialist in the same sport as our previous athlete, for 20 days. And they actually won the bronze medal in the 2006 Winter Olympic Games. So here we have someone with similar injury, similar size, actually worse injury, I should say, who has a different approach, and the return to play is 18 weeks, and they did awesome, versus somebody who was many, many more weeks. So let's look at that case study comparison here. The funny thing is, when you see these side by side, you're looking at the same athlete. The first time she tore her ACL, October of 2004, she was very other-referenced, had very different cognitive appraisals. The second time she tore her ACL, October of 2005, was actually a more severe injury, but it was very self-referenced. It was a very familiar process. She had the coping resources. She had the stress history. And so she had a much, much different approach. And look what her recovery outcomes were. Much different. We have a recovery outcome of 44 weeks versus a recovery outcome really of 11 weeks, and getting the bronze medal 18 weeks. So here we have 26-week difference between the two cases, but they're the same person. It's really just the same person a year apart. So really we're looking at case 2. She'd had 2 ACLs within a year and a half or 2 years. So hopefully you recognize here that this woman represents a great example of how our cognitive appraisals, if we reshape them and what our experience can teach us, that we can have much, much different return to play and recovery outcomes. So moving forward, our highest risk athletes for sport injury are those who are postoperative, who've had a lot of success or have had trouble achieving that success post-injury, or those that demonstrate some sort of negative affect, so low compliance, low adherence, and they tend to get poor outcomes. There's always one. There is always one amongst a group of athletes. A number of things that we can do that are critical to rehabilitation success. Mental skills training that we did in the last section is very important. Formal counseling, psychotherapy, and or biofeedback are also very helpful. As an exercise scientist, it's important that we build rapport, educate, promote, and stimulate these coping skills, and have them practice these skills while they're working with us. The other thing to think about is that adjustment is a part of sport. That's what makes an athlete and an exerciser an athlete or an exerciser. That you're constantly adjusting, whether it's across levels from JV to varsity, or you're thinking about retirement or selection. Those kinds of adjustments are an inherent part of sport. You're adjusting to a hill, you're adjusting to a downhill or a turn or heat, what have you. We know in collegiate student athletes, up to a quarter of our collegiate student athletes express psychological distress post-injury, so it's pretty common in our college athletes. And it typically revolves around appraisal and those reactions, emotion, behaviorally, much like we looked at previously. A special case of sport injury is what we call dose-response reactions, sometimes referred to as burnout or overtraining or staleness. We have to be careful with all of these factors, because the terms get used interchangeably and they're not interchangeable terms. The other thing we have to be careful about is understanding that these dose-response reactions are not simplistic. They're very complex. They have physical, psychological, social, and emotional components to them. They're not just, oh, I got to take time off, I can't exercise. No, there's psychological components to them. You can see Silva's positive and negative reactions to stress, and really, excuse me, if you want a Nobel Prize and for research, or if you're interested in research, here's a great place to start, and that's to understand how we move from staleness to overtraining, and recognizing that once we get some sort of official definition of overtraining, then typically that's a 6 to 12 month process going to the left. It is not a process you can reverse. You have to do some sort of overtraining, burnout, withdrawal before you re-enter into a positive process, and so that hence the tail of that model is one way. But the idea here really is, how do we go from stale to overtraining, and how do we divert that? How do we push you towards maintain, increase, or actually decrease, if we want it to be healthy, the training stimulus and keep you going? We just don't know. Ultimately, modifications, what I call variety is the spice of life, are key. The only key we know of right now. Modifying our frequency, intensity, and duration of exercise and activity, whether it's sport or physical activity, is important. Again, variety, making sure that they have fun, they have rest, they have cross-training, they have someone they can talk to and get the social support that they need, and they get both a physiologic and a psychological workout. Those are big pieces for aggression in sport, where we're going to be handling and discussing how aggression appears and how it occurs in contemporary sport. There's a number of examples, and I've got some somewhat dated examples on the slides here, but the idea is that it is a continual and ever-present piece of sport. But what we really want to look at is, how frequently do we see it, and why do we see it, and is there any way that we can reduce aggression in sport? So that's really the importance behind what we're talking about. So really, let's begin with the foundation of aggression. So it's any behavior directed at another that's directed at harming them, okay, who then wants to avoid that behavior. If they don't mind being harmed, then it's really not aggression. I'm not sure what it is, but it's not necessarily aggression. So think about that. Aggression is behavior. It involves harm to someone else. It's directed at a living organism, and it involves intent, with the intent to avoid it on that other person's part. We break that up into two primary pieces, what we think of as hostile or reactive aggression versus instrumental aggression. So hostile reactive aggression, really pretty simple. It's the aggression we most often think about. It's, I want to hurt someone or do psychological harm to another living being. Instrumental aggression is not necessarily about doing harm. Harm may happen, but it's about some non-aggressive goal. For example, getting the puck, winning the game, getting ahead in life, whatever you may see, but it does involve something that's detrimental to someone else that they want to avoid. It's just not their primary goal to hurt someone else. And it's important for us to recognize that aggressive acts and behaviors are not just what we call dichotomous or on or off. They're actually a continuum. And so then you have something like, say, a fight in hockey. Maybe that's purely hostile aggression. I just don't like you and I want to beat you up. But chances are it's somewhere in between. Maybe I'm the enforcer to protect our star player, and so by fighting with you, I'm protecting my star player, but then, also maybe I just like to fight, or I don't like you personally. So that shifts us more towards that hostile end. Whereas you might just be the enforcer. I might like you a whole lot, but I might have to beat you up just to keep my star player protected, which is very instrumental aggression. And so you think about that in hockey, you think about it in any sport whatsoever, and you can probably think of really good examples of purely hostile, purely instrumental, but a lot of them are fairly mixed. So think of it in that continuum piece. There's a couple reasons we believe that people aggress. We can kind of talk about those very briefly. Instinctive theory, there's really no support for that. That frustration aggression, although frustration probably does play a role in aggression, it is not the sole result and direct result. Social learning, there is some support for this. Important that we understand and we learn through aggression. We learn through behaviors. So think of a child that learns aggressive behaviors or how you handle arguments or those kinds of things, or that you learn from seniors and upperclassmen or leaders on your team how to respond in a certain situation on the softball diamond. We've since just taken that social learning piece, tried to meld in a little bit of frustration, but it doesn't always say that frustration leads to aggression. It may increase the likelihood, but it definitely increases arousal and anger, of which aggression can be a consequence of that. Our general aggression model, in a sense, it's more specific. In another sense, it's more watered down. That it's specific to aggression, but it's a general what I call amalgamation or conglomeration of frustration and social, and as well as one's individual personal thoughts and feelings, as well as the society around you is the cause of aggression. That's typically how we think of this, these personal factors, or an interactionist perspective. Haha, imagine that. Person situational factors leading to an internal state, appraisal, and decision process. And so you either have this thoughtful aggressive action or impulsive, and thoughtful being instrumental aggression versus impulsive being that hostile or reactive. A couple things to think about. I always pick on hockey here, and I'll apologize to my hockey fans. But I think hockey's a fantastic example, and the fact that I'm not a huge hockey fan, and hopefully it doesn't bias it too much. Hockey athletes go to fight school. They go purposely to learn how to fight. And I think we're going to have an activity associated with that. And what does that say? Is that hostile or reactive, or is that instrumental aggression? That a fight school exists there. The other thing to think about is that there are job roles that have you as the aggressor, specifically to hockey. But you can see in other sports where athletes have gained notoriety for that role, and there's great memoirs out there of athletes who took on that supposedly hostile aggressive role on purpose, rather than it being reactive. It's hostile aggression. So I want you to think about that. The other special case I want you to think about is what we call spectator aggression, and there's a unique class of individuals, specifically in the UK, that we call hooligans and hooliganism, which is often a group of younger, white male, underemployed, disadvantaged youth or young adults who go to the local the local soccer club matches, not to watch their team play. They go to beat up someone from the opposing team, period. Typically there's alcohol involved. These folks tend to have a fair amount of alcohol abuse in their lives, but they use sport as a means of fighting. And that's their enjoyment. That's what they enjoy. And it can take a ton of different forms, whether they're roaming around outside the game, or it can take the form of them going to the game and initiating fights in the stands. There's horrific examples of fan behavior in UK soccer, where they throw batteries at opposing fans or darts and things like that. And so this hooliganism, as we think about, is a special example of aggression. Now, my question to you that I'm going to leave as a rhetorical one is that hostile reactive, or is that instrumental? The other thing that we haven't talked a ton about, but I do want to bring up this idea of what's called bracketed morality or game reasoning. And it came about, a lot of this research came about, again, through hockey, where we thought, wow, hockey players are constantly fighting on the ice. In society, chances are they're really aggressive. That was the theory. I'm not saying that's true. And so they did this study on hockey athletes, and they found, wow, that's not what happens. In fact, you can have the most violent hockey player on the ice, but off the ice, they're an upstanding, upright citizen. And it turns out that they suffer from or engage in what we call bracketed morality. They understand that morality is different on the ice than it is off the ice. There's time and place. Sometimes we call this cultural relativity. And the culture of hockey is that you go out there and you fight, even though there's rules against it. You get a 2-minute penalty. 2-minute penalty. But when someone rear-ends me in the parking lot, I don't get out and beat the crap out of them. That morality is different. I get their insurance information. Maybe I yell and curse at them, but I don't physically hurt them. So It's an interesting piece that we've actually found in support of hockey players that this bracket immorality occurs. Now, what we don't talk about is bracket immorality in the press, which is really interesting, and we do give athletes a lot of special considerations, or I should say special attention, when they engage in inappropriate behavior. So that's where the bracket immorality piece gets kind of murky. The other thing is aggression. Does aggression lead to athletic injuries? Good question. I mean, definitely aggression tends to lead to injuries. Do we hurt people and to take them out of the game on purpose? Is that hostile or is that instrumental? Do we engage in purposeful hurting of someone else to get them out of the game? So it would be an even mix of hostile and instrumental aggression. And that's, I talk to wrestlers about this because, typically with a wrestler, if you see that someone has tape on their knee or their thumb, you go after that knee or that thumb because it means they're injured. So when I worked a lot of wrestling, they would let me tape them for competition because that showed the other person that they had a weakness, and they were afraid of, sort of that mix of hostile and instrumental aggression going after their weak point. Other sports-specific pieces of aggression that we need to think about that I think relate back to physical activity as well. It's the high ego orientation and that low level of moral development. This is what I call Friday night softball in the summer, where people tend to drink a lot and they're all about winning versus when they don't necessarily have a lot on the line. Or they feel wrong to begin with, so the referee hosed us on that call. Things tend to get out of hand after that, so we talk to referees about maintaining control of the game. We also see this need to show how tough you are, or they see it as a part of the game. I used to umpire Friday night Tavern League softball in western Wisconsin. It was a disaster. It was no fun because most of the teams were sponsored by taverns. Most of the teams were drunk when they started the team, or had been drinking when they started the game, and it just got progressively worse. And they met all these things. Aggression was a part of it. And it wasn't softball. It was more sort of like cavemen jumping around, beating themselves on the chest. When will aggression occur? This is a hugely important piece because we do want to avoid it, or at least step around it if we possibly can. We need to recognize that when there's perception of unfair or disadvantaged coaching, when there's embarrassment, when there's physical pain below capabilities, and certainly when we're behind, are important situations. And we do see this in sport as well as we do see this in physical activity. When people feel they're being treated unfairly or they're being embarrassed, they tend to lash out with that hostile, reactive aggression. Things that we can do to help improve this, certainly in a youth sport context, we try to keep winning in perspective. We try to maintain appropriate behavior. You see some great signs out at Little League ballparks now that says, remember they're little boys and girls, and they don't play for the St. Louis Cardinals or the New York Yankees, and there's no title match going on here. So trying to keep things in perspective is usually the biggest one, but also confrontation is an important piece. From a spectator standpoint, alcohol has been shown time and time again to be the number one modifiable factor. Hence, a number of leagues and stadiums are removing alcohol from the stadia, although it's actually going the other way too to increase revenues. The alcohol control policies are being allowed, I should say, and it does change spectator behavior. Some stadiums have very swift, strict penalties for aggressive behavior. Two stadiums that come to mind are the Philadelphia Eagles football stadium and the Green Bay Packers football stadium. Philadelphia Eagles actually have a court in the stadium on game days with a judge, and so you can be processed very quickly for your aggressive behavior there in the court, and they have enough to keep the court busy, which is kind of sad. The Green Bay Packers have a very, very strict policy about fan aggressive behavior, specifically that they not only will they eject you from the venue, but they will take your tickets. And so tickets being somewhat hard to come by up in Green Bay, even if they're not my tickets, say I bought them from my friend, they would take the season tickets from my friend as a way to punish good behavior. So that way you only send people you trust to sit in your seats. The other one, sometimes we see this in Canadian broadcasts of hockey, is that when a fight breaks out, they don't show it. They tend to show the announcers, and that's a way not to glorify that. aggressive act. From a position standpoint, it's about coaching, it's about banning alcohol. Again, it's the media perspective. Um, make sure we understand why it happens and punish those who perform the acts of hostility. That's what we don't see a lot. We don't see a lot of punishment. 2 minutes for fighting is not necessarily a deterrent. In hockey, for example, an ejection from a game certainly is a punishment, but we see a lot more 2-minute penalties. So those are kind of our position stands. And this is really just a quick primer on aggression in sport. It's a really exciting area to study, but for the most part, I want you to understand the difference between hostile and instrumental, be able to give me an example or two of how we might differentiate between those two, when we might see aggressive behavior, and how we might reduce the chances of seeing aggressive behavior.
That's all, folks.